After dealing with mental health struggles in middle and high school, Raymond Palma is well aware of some of the challenges his peers are facing.
I know how much it would have meant in that moment for someone to have reached out and asked me how I was doing and to let me know that I'm not alone in the struggles and that there is a brighter future.
Free hugs to anyone who wants one.
Palma is a junior at UNC Chapel Hill, where hearts have been heavy following reports of 2 deaths by suicide since the semester began. It's highlighted the burdens and stress that college students feel as the pandemic drags on.
I think with a push back to normalcy, as welcome as it is, I think it's important to remember that when it comes to mental health, there is no normalcy.
In an effort to help, Palma recently became an instructor for the Mental Health First Aid Initiative. It's a program launched by the UNC system in response to the rising mental health needs among students. The North Carolina Community College system is also offering the training at their 58 colleges across the state. The training is designed to help students, faculty, and staff recognize signs of an issue and provide effective early support.
We've been isolated so long, and I think there's a lot of people out there that are just waiting for help, that don't know how to ask for it, but are exhibiting some concerning signs. And so if you can recognize those signs, feel comfortable reaching out to them, and then connecting them to the right resources, we want to help people live a better life.
By December of 2022, classes will provide qualifications for more than 10,000 mental health first aid certified faculty, staff, and students at campuses across North Carolina.
I hate to wish time away, but in many ways I want to wish the next year away, because I want to be on the other side where we say there's 10,000 people out there that are first aiders and that they are recognizing the signs of distress and that they've probably saved several lives over this past year. And so I'm very excited to see how this will help us create more meaningful, helpful communities. And really, if we just save one person, it's just going to be all worth it.
Nice job. Thank you for being silent and being ready. Excellent job.
The pandemic has also had an impact on the mental health of K-12 students. Data from the CDC shows that mental health-related emergency department visits have increased since the pandemic began.
Let me have everybody's attention.
It's one of the reasons the North Carolina Department of Public Instruction is helping school districts promote social and emotional learning.
The more we've learned and the more we've really gotten into children, how they work, how they tick, what's really good for them, the more we've realized that we need to pay closer attention to that social and emotional piece. It's not just academics.
For Raymond Palma, he's optimistic about the work surrounding mental health and believes it's building the framework for a more resilient future.
Because a lot of times, you can feel like you're really alone and you're not. And there are resources, there are people that care about you, and you are going to be able to get that help.